everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Xealth and SilverCloud. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion, and we will get to those at the end. Afterwards, stay on for expert mixologists Natasha and Rich. The husband and wife duo will be shaking things up with a refreshing mocktail and cocktail demonstration. And with that, I will throw it over to our moderator, who joins us from Xealth, Mike McSherry.
Thank you. Hi, everyone. I'm Mike McSherry. I'm the CEO of Xealth, and I'm here to discuss COVID's other wave, the mental health challenges that exist. We're all familiar and aware with the physical diseases and challenges that COVID has brought and wreaked upon this nation. But it has also brought social isolation. It's brought a number of anxiety and stress and the economic uncertainty with the unemployment situation and the challenges of going out and facing life in a new normal, wearing masks and other social distancing measures. We're being introduced to a range of new solutions in society and how we challenge this. And there are a range of different tools and therapeutics that can help address this, and that's what we're here to discuss today. I'm with Xealth. It's a platform that allows clinicians to prescribe digital tools to patients, and those tools can be content assets, articles, videos, apps related to maternity care, behavioral health, diabetes management, devices to monitor patients' clinicals and vitals, as well as services such as meal delivery or transportation or e-commerce product recommendations. Over the years, we've been working with Froedtert Medical College of Wisconsin and SilverCloud to bring a digital health solution specifically to address the mental health needs for this country and the patients that need access to tools. In light of the whole COVID response and the shutdown of clinical visits and procedures, digital and virtual has come to the forefront. So that's what we're here to discuss today. I was notified just in front of this session that over 500 registrants signed up to listen to this panel, so which is 10x the volume of what they've seen in some other sessions. So there's obviously significant interest here, and we're here to learn about the solutions, opportunities, and future state of bringing digital health tools to a broader set of Americans as we deal with these challenges. So I'm joined with Dr. Brad Crotty from Froedtert, from Karen Tierney from SilverCloud, and from Divya Polieville from Horizon Blue Cross Blue Shield of New Jersey. So with that, I'm going to let each one of them introduce themselves, provide a couple-minute background of themselves and their company, and then we'll get into the session. Karen, would you like to start?
Yes, sorry, you caught me in the hop there. So hi, everybody. I am the co-founder and chief product officer of SilverCloud. I have a background in the humanities and creative arts, as well as biomedical science and health technology research. So I've spent the last 12 years building psychosocial interventions in both oncology and mental health settings. And I hold the responsibility for the product, ensuring it's fit for purpose, meeting customer, clinician, patient requirements through delivering kind of outcomes and engagement that are on par with traditional methods of care. So a little bit about SilverCloud more specifically. So SilverCloud enables the delivery of clinically validated digital mental health treatment or in therapeutic care. And it's also care that will increase access and scale through digital delivery. It also reduces costs and has outcomes that would be on par with kind of face-to-face or more traditional methods of care. We're based on over 17 years of clinical research with leading academic institutions. And in fact, a quarter of the company today continues to be engaged in research. We're used by over 300 organizations globally to meet their population's mental health needs. The platform has been validated through full randomized control trials and also real world data from over 475,000 SilverCloud users. So yeah, we have been working with Froedtert and Xealth for the last couple of years. So really honored to do that. And I suppose, when we work with somebody, it's a deep partnership. We make it work. We sit down, we break things apart, we put them back together again to make sure that success is on the table for everybody. So we're really passionate about that. And we feel like that's been reflected in we've had a practically zero churn in customers over the last 10 years because of this approach, which has worked really well. And in fact, a recent round of Series B funding has been made up of a syndicate of existing partner health organizations. So really proud of that.
Great, thank you. Divya?
Hear me?
Yep.
I serve as the Chief Clinical Transformation Officer at Horizon Blue Cross Blue Shield of New Jersey. In that role, I oversee the value-based that we do.
Divya, you appear to be stuttering in the video transmission.
Okay. Should I repeat myself?
Yes, please.
Okay. Can you hear me better now?
Yes.
All right. Hello, everyone. This is Divya Polieville. I serve as the Chief Clinical Transformation Officer at Horizon Blue Cross Blue Shield of New Jersey. In that role, I oversee the value-based and clinical transformation work that we do across our provider partner base. And I'm a primary care physician by background.
Great. Brad?
Good morning or afternoon, everyone, depending on your time zone. My name is Brad Crotty. I work at Frederick in the Medical College of Wisconsin. I serve as the Chief Digital Engagement Officer. We are a academic health system, academic community health system of 3 hospitals, about 30 to 40 community health centers in our region of southeastern Wisconsin. And we have been both partners with both SilverCloud and Xealth over the last number of years.
Great. Thanks.
Perhaps I can just, yep. Mm-hmm.
Thanks, Dr. Crotty. So we've been working with Fredert in delivering a solution to a broad set of your patients. Xealth prescribes tools for behavioral health, for hypertension, for patient education, and mental health, of which there's a huge preponderance. As we've been working with you in SilverCloud, we recently published a case study and article about the benefits of the solution in meeting your patient needs in mental health and mental illness. Would you like to talk about some of the data and benefits that's been defined for your patients from that? And then Karen, I'd like for you to specifically talk about which patient populations SilverCloud addresses. And I've seen data that shows, 20 to 25% of people in America have some form of mental illness or mental health condition, whereas SilverCloud targets a more discrete set of patients. So, let's have some of that data and then let's discuss specifically the audience population that SilverCloud aims to address.
Sure. Let me rewind a little bit. We'll, I know, eventually talk about the challenging times that we're going through right now, but we really started our digital mental health work actually 3 years ago, almost to the day today. So it was in 2017, and the problem that we were trying to solve is probably something that many health systems are trying to solve, is that we were rolling out and trying to do a better job about screening for depression. Depression is a condition that is often underdiagnosed, or put another way, more people struggle or suffer with some form of depression or anxiety than they necessarily are willing or do patients and clinicians really have time to address and manage, particularly in busy primary care visits. And so as we rolled out our depression screening program, we wanted to make sure that we had a scalable solution that we could offer our primary care clinicians who would be left with a summary or a positive screen that they needed to help the person with, but now's the now what, and so that now what, we looked at the digital tools in addition to our other access points for behavioral health within our system. But what was appealing about a digital tool is it would be very, very scalable, and it could be something that could be more rapidly incorporated into people's lives. And we really looked at the Silver Cloud, the digital mental health tool, as serving a couple of different roles. It could be primary treatment for someone who just wants a little bit of sort of the internet CBT. I just want to sort of do this on my own. It could be used as an adjunct therapy, meaning that several of our folks who we refer over to behavioral health will also use this as some self-work in between visits. And then it could be a bridge between the primary care and getting to behavioral health. So we've been running this now for a number of years, enrolled a couple of thousand patients in the program. It is a digital enrollment, so it's done within the flow of the electronic health record. Can be a discussion at the point of care, a recommendation made, and then an online enrollment done through the electronic health record through our tools. So we've enrolled, a couple of thousand people. I think like 2,400 or so, just kind of within our primary care over last year's, and we've prescribed it to more. And sort of, what we found is about half of the folks will go and fill. I sort of call it filling the prescription. But it's interesting, like when you actually get into the folks who have more moderate depression, the fill rate is really around 65%, roughly. So certainly not everyone does it, but certainly a majority of people will do. And what we're finding is sort of people in that moderate depression category, 3/4 of them will show some clinical improvement. Really is put forth by a follow-up PHQ-9, which is our standard outcome measure that we use. It's sort of a 9-question instrument, and people decrease. And as we look at across, this is both for anxiety and depression, you look at across all the different ranges, we see generally people decreasing all of their scores down. So the curve sort of shifts from sort of moderate stress, anxiety, more to much more mild or more negligible stress, anxiety. Of course, not everyone gets better, right? So this is, depression and anxiety are complex. This is one facet of treatment. What's nice about the program that we have is that we also have a supporter who looks in and engages with folks on the back end, and they are able to look at and escalate folks who are kind of have a trajectory of not doing as well. And then we make sure that we meet their needs in other adjunctive ways, whether it's sort of an expedited behavioral health appointment or sort of following back with their prescribers to let them know what's been going on. So we've seen those with anxiety. I sort of was mentioning depression. With anxiety, we've also seen good where over half of folks are showing really significant improvement. And again, what's nice about it is it's able to be done either as a adjunct to other forms of care, or many people are doing it on their own.
So roughly 2/3 of patients are actually enrolling in when it's been recommended by their doctor, and an even higher percentage are showing signs of improvement. To Karen, I know that we've worked with you across several different systems. Are you seeing same level of adoption rates at other systems? And are you addressing the broadest population base against mental health needs, or are you segmenting a very specific group with your solution and your capabilities?
So what we would typically do actually is to sit down with our customers and with clinicians and understand the populations that they want to reach, because the system has the capacity to kind of segment and work in a number of different ways. As Dr. Crotty was saying, it can be a bridge to care or a bridge out of care, an adjunct face-to-face, an adjunct face-to-face waitlist management or by itself. So it's really about understanding about what the provider themselves, what kind of success looks like for them. I would say typically, I'd say the broadest kind of population that we would have through the platform would have a kind of mild to moderate depression and anxiety. That's certainly a sweet spot for kind of online kind of therapy in general. We have also kind of demonstrated in trials as well as, in real world, the benefits for people who might be subclinical, in terms of like building their own resilience and so forth. And equally, on the other side of the spectrum, we've seen it used successfully for severe patients. And I suppose, like at the moment, one of the really interesting things about COVID has been the acceleration of the adoption of digital mental health. And for us, what we've seen is a new willingness to bring us into new populations where previously, we just would not have had access to otherwise. And I suppose because it's been, having that kind of sudden switch to, to going virtual. So it's how do you maintain continuity of care? So while most of our populations would come through primary care referrals, we would also now be looking at use cases within inpatient settings, partial hospitalization programs, and also maybe around populations that would have more severe and enduring kind of mental illness as well, and also pediatrics. So it's been quite interesting. So we are seeing the breadth of the populations that we reach expand. Particularly in recent times.
That's great. Brad referenced something earlier, and maybe you could help educate the audience here. He referenced CBT. Can you define that and the role that plays in digital therapeutics?
Yeah, certainly. So CBT is cognitive behavioral therapy. It looks at how your thoughts, feelings, and behaviors are linked. And what works really well about CBT is that it was a manualized kind of therapy, in that, it kind of follows a specific structure. And when you are in a, sitting down with a therapist face to face, you're not necessarily going to know that you're doing CBT because they're maybe pulling the different kind of protocols and working them with you. But when you are doing online CBT, it's just, there's a really kind of structured approach, and it's kind of very clear about what bit relates to what part. So say in depression, you'll have something like behavioral activation, in which you're helping people to kind of, get motivated or start doing either the things they need to do to look after themselves, or to do the things they might have stopped doing because of their depression that they used to enjoy. And so it's just something that works really well online, and that it's there, we deliver it via content in various kind of forms of media, videos, animations, and so forth. And then you're providing people with tools that they can interact with, and you're giving them kind of case studies or personal stories. So you're always building on kind of concrete examples, and you're helping them to kind of to apply it in their daily lives. Like the whole kind of premise of the platform is around helping people to develop a level of self-awareness, and to kind of self-reflect on maybe what might be causing, might be triggering for them. And then once that kind of level of self-awareness is raised, and you can do that, using tools like the mood monitor, and we have kind of other more self-reflective, maybe more journal type entries in which people can explore certain difficult aspects. And then once people have achieved a level of that, or starting to build that, then you kind of build in self-management as well, because, we're not out to create, users that are on the platform forever. CBT is a short solution-focused therapy, and you really want to basically skill people up, so that when they finish the therapy, they have the skills and strategies that they need to manage their triggers. And so when they go back, when they go out into the world, as it were, maybe the first time they hit a trigger, it kind of felt like a bit falling off a cliff, but they pulled themselves out of it. But maybe because you can't, you're never going to be able to sit down and make a list of all your triggers, work them out in therapy, and move on. So then when you're back out into the real world and you hit another trigger, it's because you have the skills and toolkit there and you know what you need to do to kind of bring yourself back up. It's kind of less like falling off a cliff and more like stepping into a puddle. Sorry, I could talk about that all day.
No, I'd rather step in a puddle than fall off a cliff.
Yeah.
Nice
Agreed.
analogy. It must come from the Irish in you.
Maybe.
So it's not just recommending someone to walk down to the pub and meet the mates.
No, indeed.
So Divya, to the payer perspective here, the payers are the ones that often define a covered benefit and what they'll reimburse for. And in this case, Freighter felt the need that they need to address a looming challenge amongst their patient population and to provide digital health tools for mental health to their patients to help scale their doctors is what Brad said. So on the payer side, this webinar started actually with a picture of a beach. Sure, that's emotional well-being. Why don't you reimburse for a beach vacation, and that would make me feel good. How do you define what is a covered benefit, and where do you see digital therapeutics and especially mental health tools falling into a covered benefit versus what has traditionally been face-to-face therapy sessions and defining the clinical need, based upon that face-to-face assessment?
Yeah, one thing that has emerged increasingly, Mike, and especially with COVID-19, right, is that to meet the multiple needs that our populations, our communities have, right, we have to be able to meet those needs via multiple channels, right? And that's a combination of both brick and mortar settings as well as virtual settings. So our behavioral health team already, and this journey started a number of years ago, engaged with multiple platforms to solve for those varying behavioral health needs of the communities that we serve. Some of those interact directly with the members. So the example that Karen said of CBT, which is self-directed, while several others are tightly integrated with and driven by our provider partners. And so with that, a couple of factors that we have seen drive up the adoption rates, because ultimately the outcomes that get served by any of those channels, whether virtual or face-to-face, in terms of meeting the needs of the populations, is what drives their availability and their reimbursement, right? So to be able to drive those adoption rates, first, one thing that we have seen to succeed is where there is integration with providers. How do you take it to the physician practice level to understand their workflows and customize to what will work is important. So to give you an example, about a couple of years ago, we launched this virtual collaborative care model where, driven by primary care practices, we implemented an algorithm that would help identify individuals with unmet behavioral health needs and then connect them to behavioral health providers. And when we took this to one of our primary care practices that has been extremely clinically mature and has implemented its own virtual behavioral health care coordination system, the response that we got from them is, we do not want this platform to be directly available within our practices. We instead want it to serve as an overflow to whatever needs cannot be met by our already integrated behavioral health team, right? So understanding the nuances and how exactly any of the solutions fit within the overall structure of care that is provided to the members is extremely critical to us in terms of what gets covered versus not. And then the second thing that I would just like to emphasize is, a lot of the solutions that we see today solve for very niche problems within the overall continuum of care in behavioral health. And that is okay, because we need them to be really good with what they do. That said, we then need to bring these solutions together, orchestrate them in an ecosystem such that they complement each other, they talk to each other, and grow each other. And so I think those are some of the factors that we have seen to drive not only adoption rates, but also how we bring certain solutions in as covered benefits.
Okay, so Divya, I saw on Wikipedia, so I know it must be true, that you guys have a little over 3 million covered lives. Would you know how many, what percentage of those lives get some sort of mental health treatment or programs or reimbursement? And then what percentage of that is digitally met versus, face-to-face brick and mortar or medications or other traditional therapeutic, kind of support?
Yeah, so we have so the part of over 3 million membership is true. We have close to 3.6 million members today across the state of New Jersey, and depending upon which population it is, whether those are employer-based accounts or those are our Medicaid members or our Medicare Advantage members, there are varying solutions that meet those needs. Both, obviously, we have an expansive network of behavioral health physicians as well as facilities that serve this membership. But outside of that, we have made investments in multiple solutions, ranging from those that cater to those with mild acuities all the way to severe mental illness as well as substance use disorders. And based on where those populations serve, we have solutions targeted to each.
Okay. Not SilverCloud? You just heard the amazing stats they're getting. Great. So you also referenced something about workflow integration and the payer-provider collaboration. Dr. Crotty, where do you see that sitting, the necessity of workflow integration of these digital therapeutics and your relationship with the payers to help subsidize, to offer it to a broad set of patients as a covered benefit?
Yeah, no, great question. So, when it comes to workflow, I think the comments were spot on for this to be really adopted and be. I mean, it's also adopted by the patients too. Given the choice between having something that is part of a broader care strategy or something that is more standalone. I think what we've seen in a number of digital studies and research, that having something connected and being, having a human on the other end as opposed to being just purely technology does improve adoption. So it's not different here. Where we focus on the workflow integration for a tool that it's sort of individual, that an individual does on their own at home is sort of in two locations. One is we do it at the point of sort of recommendation and discussion. And so by putting into the workflow of screening for depression, we can identify patients who meet that criteria. We can use our decision support tools to then recommend services like digital and like SilverCloud in particular around ranges of scores. And then the other piece of it is, well, that how are they doing with it within once we integrate into the electronic health record, we can then go back and have conversations to say, well, I see that you're getting better, or I see that you're getting worse over the last week or two. Can we talk about that? And so whether it's at a visit or whether it's something that gets escalated, that connectivity helps enable those conversations, which we think makes a more meaningful experience. Not to say that it's not a good experience on their own. We are increasingly interested in tools that exactly can free up or sort of help level load where in-person providers are. But I think that workflow discussion, that workflow connection is important on both the ordering and the monitoring. And where it comes to payers, one of the challenges that I think we have as speaking for a health system, but I think that is not unique to us, is that when you have services that are particularly only covered under certain contracts, it becomes very difficult to know at the point of prescribing, this is going to be covered for you, but this is not going to be covered for you, or I can't prescribe this, or I can't prescribe it. And even if we do maintain the logic and the insurance updates and the eligibility files and provide that into decision support, it still doesn't quite feel as as smooth or as natural in that recommendation, because these sort of it seems like it's one of those, to me, one of those things that if you have a criteria that you meet where this can be of help to you, we should just be able to do it regardless of payer. So that's the approach that we have taken. Thanks, Charlie. And when it comes to working with the payers, we have prepped for a lot of this in the sort of value-based care world, although clearly we are, we're still in this very mixed fee-for-service value-based world. And so we have taken the approach of being payer agnostic and providing the service to meet the need. Although we have gone back to and started discussions with some of our larger payers to see how these digital tools fit into some of our contracts.
Yeah, I mean, that's one of the challenges of US healthcare is sometimes they're consumer paid kind of OTC level efforts. Sometimes they're hospital provided services, and then sometimes they're payer covered services. Karen, we watch TV, we see LeBron James, we see Michael Phelps talking about Talkspace and Calm, and they've raised gazoodles of money, and they're kind of a direct to consumer app in the App Store. And sometimes it's like stress or anxiety or mental focus or self-actualization. I know that you guys were talking about being doctor prescribed, so it's against a clinical condition that I presume has a higher level of bar of need. And can you discuss the different market segments and where like Talkspace and Calm might be relevant, and then where you guys are relevant? And then I've got a follow-on question as well. Some of the Q&As from the audience address whether or not SilverCloud is targeted at doctor systems prescribing or insurance companies referring their members to, or whether there's an employer-based or direct-to-consumer-based offering for your service.
Making notes there, yeah. And so I suppose just from the very beginning, I mean, we come from a research background, and so we're always incredibly focused on efficacy and outcomes, and that's what we deliver on. We're not looking to, as I say, kind of have long-term users, on a subscription model. That's not how we work. And we were really looking also to solve the problem around, the shortage of clinicians. A lot of, people that would be seen in the same space of us have essentially replicated face-to-face care in a virtual environment. And what we were looking to do is see how we could extend, clinicians' capacity, because, everybody knows the shortage of mental health professionals in the US. 60% of, counties don't have any mental health professionals. 40% of therapists are reaching retirement age in the next 4 years. Like, it's horrendous, and there's less and less, therapists graduating every year. So we're like, well, how can we deliver care that's kind of one to many? And so what we basically did was we built our kind of the coach that's in the loop for us. It's like we call it the asynchronous model. So asynchronous means it's not real time. So basically your coach will log in, they can kind of review what you've done, and they'll leave you a message, and you'll know when you'll know when to expect that message, and B, you'll get an email to say that the message is there. And what we see, and just to say that the treatment, the intervention is actually the program itself, and that the coach is really there to kind of motivate and drive engagement. They're there to answer questions, and they're there to maybe signpost you to particular content, and also to maybe unlock additional content to personalize treatment for you. So they're kind of with you on your journey, but they are not, you are in the driving seat, as it were. So what we found is that when supporters or coaches are used to leaving reviews on SilverCloud, that they can support between 6 and 10 people an hour. So if you just do the maths there, you're extending care, by huge factors. And given the increasing demand and awareness and the decreasing supply, so we were just very much focused on doing that, and also ensuring that the outcomes that we deliver were on par with face-to-face. This efficacy has always been core to what we do. So we're also really mindful that we are first and foremost a technology company. So with that in mind, we don't necessarily want to build out a huge we don't want to be a healthcare system. So really it's like, well, how do we plug in, and how can we enhance and augment existing care pathways? So with that, we really kind of focus on working more specifically with kind of healthcare providers. Often there are people there already, LCSWs, that there are people who can work on SilverCloud. They don't have to be like full-time coaches on SilverCloud. It can just be part of their kind of their workflow, as it were. And so kind of bearing that in mind, other things that kind of fell out of that was how important interoperability was, reducing kind of clinician burden. And because ultimately it's all about the sustainability of the solution. There's nothing more annoying than bringing in, everybody experiences, IT says use this technology, and then it falls by the wayside and it's game over. So it's like, how do we make sure that this is like a living, breathing part of treatment care pathways? So with that in mind, it was much less about the D2C. I'm not saying we'll never explore that path, because like the company mission is, having, mental health, access to mental health care for everybody. So it's not maybe something I would shut the door on right now, but definitely our primary focus is on, working with, partnering with kind of customers. So it would be a lot of the kind of doctor systems. We would also work with payers as well, absolutely, and employers as well. And in fact, what we've seen more recently is healthcare providers applying SilverCloud within their own, within their own kind of staff as well, their own team. And we've just had some really interesting kind of feedback from that. We've seen one healthcare system, and they saw utilization rates of 15%, versus a typical, say, EAP access rate of 4%. And that was 2,000 healthcare staff. And essentially, when they were kind of polled afterwards, 60% of them said they would not otherwise have accessed or sought treatment. So they're just on a path to burnout, or they might have left the organization. So you're seeing kind of a potential real-term retention of, well, 1,200 staff in that case. And in another one we're hoping to, that we're kind of working with at the moment, they've actually seen a direct ROI saving of $17 for every $1 spent on SilverCloud. And that was on like a sample that was like 1,100 employees in 1 year. Okay,
that's great. How do you actually measure the outcomes? Like when someone has improved through their time-bound session and therapy, you say you want to give them self-help skills. How do you measure that outcome improvement?
So it's the same way that it's done in face-to-face care. Essentially, patients are asked to fill in these kind of really well researched and validated measures they're clinical questionnaires. We would use the PHQ-9, the Patient Health Questionnaire 9 for depression, and then the GAD-7, Generalized Anxiety Disorder questionnaire for anxiety. So and they say in the tin, it's 9 questions and 7 questions, so they fill them in. And so maybe the first time that they fill them in, that's their baseline score, and so that's how you know. So if you're from 0 to 5, you're subclinical, but maybe if you're like 18 and above, you're maybe severe, and they're kind of like that's kind of how people are graded in terms of the levels of anxiety and depression that they're experiencing. And so essentially, as you attend therapy in a face-to-face setting, you fill them in again, and it's the same on the platform as well. So we would have the patients fill in these questionnaires at specified intervals, so that you can track somebody's progress over time. And often it's like once the patient has maybe reached that subclinical threshold, that's when they would be deemed to be recovered.
Okay. I'm going to put you on the spot. Not now. You're going to have to answer this by the end. But you said if you go DTC, you're going to have to come up with a corporate spokesperson. You know, one's chosen LeBron, one's chosen Michael Phelps. I know Ken, your CEO and co-founder, is, I don't know, probably 6'8" himself, so he's in that tall camp, and
He's 6'9",
potentially
actually. He's 6'9".
6'9".
Yeah.
So potentially he's the
3 inches too
spokesperson
tall to be a pilot.
for
Yeah.
you. But by the end, I'm gonna ask who's going to be the famous celebrity that would represent you guys in the market well. So you can come back and think about that.
It's a toughie. Yeah.
Dr. Crotty, as we are thinking about, you know, COVID and you know, we've been working with you in Silver Cloud for a couple of years. You know, obviously there's been a mental health need in the community for a long while. What specifically have you seen change or enhance or increase, and is the volume of patients being prescribed Silver Cloud increased exponentially or marginally or stayed static within your community?
We've seen increases in growth in terms of the number of folks who are using it, as well as their engagement in the tool. And so, you know, several of the challenges that people are running into are, of course, isolation, with several of the you know, the need to physical distance and stay distant from others. There are folks who are certainly in, you know, employment challenges or being laid off for the first time, and so there's certainly a lot bubbling up now, and there's also just like a general anxiety around the illness itself. And so if we look at like our quarter-over-quarter growth, we've really doubled it over the last really sort of like, you know, March into the end of June. We've doubled our rate of prescriptions in this. So it, not quite exponentially, but it is growing. You know, an area that I think is important to note is that we also have a remote monitoring pathway for folks who are at our health system and test positive for SARS-CoV-2, and we do have a remote monitoring program that engages them to check in and see how folks are doing and progressing over time. And several of the feedback that our nurses are getting are really around anxiety, and so that has been yet another referral source into the program, you know, as a complement to other work that we're doing with patient-reported outcomes, pulse oximetry, and then sort of managing the anxiety and the behavioral health around that is, it's also really not small. And so we have been working in integrating in the Silver Cloud piece with that. You know, I think one of the things our supporters have noted is that the engagement seems to be a little bit more robust. You know, a general, you know, quick look at that is the amount of time and the amount of words that people are, sort of amount of time that people are engaging, or if they do write a note to the supporter, the length of those notes, the number of words in that note, back and forth, is increasing. So both, yeah, in terms of the actual numbers as well as engagement, it seems to be increasing.
Yeah, so I mean, you've referenced kind of several things that sort of just broadly encompass virtual care. You know, prescribing apps and therapies and online wellness coaching to patients, which bridges into telehealth. You talked about remote patient monitoring and bringing that data back into clinicians to review and take corrective action if necessary to the patients. You know, obviously we've seen all the news that this is the new world order, the new path to care delivery. What percentage of care do you see being addressed digitally in the future? The telehealth and remote care options against specific disease management and RPM, remote patient monitoring, you know, to help the telehealth support and providing relevant direction and care treatment options to patients.
Yeah, it's a great question. So, you know, just a little bit of numbers to kind of ground what we've seen with outpatient around the pandemic, we've had swings as much as 70% of care being provided through virtual means, whether it's telephone or video, and most of those were video, but in the earlier days there was a mix of telephone and there as well. But once you add on, so if you add on portal enrollment and engagement, which is not as high as we think it will grow to yet, and some of that may be still the limited value proposition, but if you sort of go to 50, then you add on some sort of digital health tool or digiceutical, I think you'll get to around sort of a goal of around 70% of folks to have some sort of digital engagement or some sort of digital program as part of their care. And I think that will continue to rise over time. If we look at just the opportunity, even we have internet rates of 90+% above in households, and even among the the digital divide is quite real, though even at the lowest of the SES classes, it's still around 89% based on Pew data. So those gaps are closing, and that provides an opportunity to continue to engage, particularly meet areas where, well now kind of there's still a desire to try to deliver as much care remotely, but it also solves issues of transportation. It solves issues of time away from work. And we've had a couple of really cool success stories of people doing smoking cessation visits and counseling while on smoke breaks at work. I mean, it's much more able to fit into the lives of people rather than these sort of like episodic visits where you have to get kind of everything done in 6 months. And so I think around 70%, but it may grow even as our trends change.
Okay, Divya, I heard Karen reference, I forget, 5-to-1, 6-to-1 kind of therapist to patient kind of ability to handle, addressing, so sort of the multiplexing of resources, which, presumably is cost reducing and providing care. And, from the payer angle, you're looking to see how you can cut costs of care delivery. Is this the tipping point where you recommend or incent or demand that your members start with a digital first kind of solution, and could be in behavioral health, but more broadly, and where are you seeing the cost reduction benefits of providing digital tools and certainly with the focus on mental health?
Yeah, good question, Mike. And I want to share a couple of statistics that from our end, and those are not too dissimilar to what Brad mentioned in terms of the numbers that they are saying. So in February 2020, right before COVID-19 hit us, we were seeing a total of about 12,000 claims related to telehealth. In April 2020, that number shot up to over 700,000. That's about a 6,000% increase, right? And if we break those numbers down to a diagnosis basis, behavioral health diagnosis for by far the majority, almost a 3-to-1 compared to other diagnoses, with anxiety being the top driver there, right? Now, those peaks obviously have matured and they've lowered over the last few months, right? But it does demonstrate to us the implications of COVID-19 on us broadly as a society, as well as on healthcare delivery, right? And what we saw in the immediate aftermath was it was an either or, right? 70 to 80% of visits or interactions shifted to a telephonic or a video-based setting. And before that, it was mostly face-to-face. I think where we will increasingly be getting to is an and, right? So it's not you have to do digital or you have to do face-to-face. It is how do we blend those digital, virtual, as well as brick and mortar channels together to make sure that the needs of the patients are effectively being served, right? Now, again, there are certain conditions, there are certain populations where the digital channel lends itself to easier use, to more access. If that is the case, then absolutely, right? We are driving growth in those digital on those digital platforms. I don't see us getting to a stage where we will necessarily mandate, right? This is the way. Ultimately, it is driven by what works best for the members, meeting them where they are, and how do you integrate all of that with what our providers do and provider partners, how they serve the communities.
Great, thanks. And you know, impressive stats in there. So I'm going to start taking some of the audience questions. While this webinar has been going on, there have been a number of questions that have come in. A lot of them are focused around the direct employer and working from home and the increased responsibility and necessity of mental health needs. A lot of that has been addressed, but quite specifically, Karen, do you guys sell to employers at this point in time? Yes or no?
Yes.
All right. Are there any big name brand employers that you reference as customers?
This is the kind of question Ken answers really well.
Well, I mean, I can say we're not a big name, but I can say, you know, we have rolled it out from the employer side to staff, as well as on the educational side to our students and learners and medical trainees. So it was sort of a natural add for us to our employments.
Yeah, I also know that Xealth and SilverCloud work together at Providence Health here in Seattle. I'm based in Seattle, and a big focus of that is the increased mental health needs amongst caregivers. And Providence has 120,000 employees nationwide, so there's a large percentage amongst there. There's a question about whether this is incorporated alongside medication or specific in individual. And you know, there's a view to the emerging world of digital therapeutics that has kind of quote companion app. And I saw recently that Propeller, which is focused on asthma, you know, is now being prescribed in Europe alongside a medication as a joint bundle. Dr. Crotty, where do you see that kind of companion app alongside meds, you know, occurring in the future?
Yeah, so where I break down, this is kind of the way I think about this, the way I explain it to folks around here, is that we have medicines to help change some aspect of biology. We have medical devices to change some aspect of physiology. What's missing from both of those, which is sort of the limit of what a lot of healthcare offers, is sort of what do we have to help with behavior? And that's where I think digital can really come in and play. And so that's where, you know, the companion can really help, because it really requires, you know, some component of a combination of those three things to get to the health outcome that you want. And so, you know, we look at, for, you know, behavioral health, this, you know, this tool in particular can be something that we use early for more mild cases on its own, or for people, because I will see patients that will just say, I really don't want to, I'm not ready to take a medicine, or I don't want to. And so we will use this here as sort of our initial strategy care plan. But then people may need medicine on top of them. We certainly see, again, in our integrated behavioral health programs that we have, this is almost sort of an automatic, you know, component to that care plan. And so you have some medication adjustment and titration, but then you have the behavior also that the person's engaging with the application of tool. And then there's a whole other range, just beyond mental health, of where there's some aspect of behavior that is part of a care plan, whether it's asthma, whether it is in oncology, whether it's in cardiology, any number of gastroenterology, where there may be a medication plus a behavior that we need to adjust, and the digital can help, bridge those two worlds.
Okay, I'm probably going to have time for a single last question, and this probably goes to, I'll do the one against reimbursement, how telehealth is being reimbursed, and reimbursement for these digital therapeutics. So Divya, if you want to address how patients seek reimbursement for engaging in mental health and digital health needs.
Yeah, so telehealth today is, ever since COVID-19 hit us, has been at parity in terms of reimbursement, right? So whether it's a face-to-face visit or whether our providers are attending to the needs of our populations via telephonic or video visits, there is parity from a reimbursement perspective. From a digital therapeutics perspective, more broadly, it is a combination. Again, it depends upon, from an insurance perspective, is it an employer-based account, right? Member that we are serving versus not, right? And in the case of the former, obviously, our employers will need to buy in and agree to these digital applications being prescribed, and for the rest of the population, if there are outcomes that drive, if there are access gap needs that get met, those become a part of the solutions that we provide to our members.
Is CMS reimbursing for any digital mental health needs?
Directly, I'm not sure about that.
Which poses a question against healthcare inequality. I mean, if you're on Medicare or Medicaid and you're forced to see face-to-face, doctor visits right now, that's almost inequality versus the digital.
CMS for now, for telehealth, yes, they are.
Yeah, and in general now that these have all been relaxed in terms of what is covered during the public health emergency, especially for they have made codes available also for the visits, the traditional visit, but as well as some patient monitoring solutions programs.
Okay, Karen, who's the celebrity that would represent you guys?
I had to do some digging there. Would you believe we actually have a persona for our platform? And so I pull that out. So it's probably not what you're exactly looking for, but the kind of how we visualize our platform is somebody like Dr. Watson, not Sherlock Holmes, or somebody like Miss Honey in Matilda, or like R2D2. So the kind of person that always comes to the rescue that you want on your team, but that you're the star of the show. So yeah, that's our criteria, and that's kind of how we visualize what we do. Yeah. I like the avatar, kind of reference. Not to mention Ken, tall, good-looking Irishman. He represents well alongside LeBron and yeah,
and Michael
sure
Phelps.
does. Yeah, yeah.
He can thank me and pay me later for that comment. I think we're at the top of the hour here, and there have been a number of questions that came in, obviously, and I don't know that we're going to have time to address them all. If we're able to still continue and participate, I'm happy to see about addressing them more broadly. I'm not sure the exact cutoff here. Most of them refer to employer-based questions of reimbursement and accessibility, and I don't know if that's representative of the audience, kind of questions or the needs out there in the market. Oh, I'm seeing a little note that we can continue the conversation. I don't know about everyone else's. Continue the conversation on Twitter. So I apologize that I didn't have that. What I would like to do, though, is thank, certainly Dr. Crotty and Dr. Polieville and Karen for being on the front lines and providing, care and needs and solutions to the market and to patients that obviously have a need. And, we're all facing this as a country and a new world order, and you guys are on the front lines providing care, and we thank you for addressing this vast need in this country. So thank you. And I only think we're going to continue to see more and more digital tools and improvements and benefits scaling. So we'll conclude on that. Thank you for your participation, everyone. And thank you to Health for hosting this webinar. And we would have seen you guys face to face, coming up here in the fall, but that's been canceled in this new world reality. So let's all conclude, and good luck, and thank you for the care.
Thank you to Mike and all of our panelists. If you'd like to join us in continuing the conversation, please join us on Twitter using the hashtag on the screen. Now I'd like to introduce our expert mixologists, Natasha and Rich.
Hi, everyone.
Hello.
I'm Natasha Soto-Alvarez. I'm a New York City-based mixologist, most recently at Motel Morris Restaurant in Chelsea.
And I'm Rich Strayer, sommelier at Blue Hill at Stone Barns in upstate New York, and cook in Tiki Cocktail.
And we're here today to share a few recipes with you. We're a husband and wife team, and together during this quarantine period, we've been teaching a lot of virtual mixology classes, giving wine tips to people. We find that people are really enjoying learning a new skill set at home and sort of upping their happy hour game.
And we're super grateful for everyone who wants to hear from us, because we need things to do.
Absolutely. So today we've chosen to feature one cocktail and one zero-proof cocktail, or mocktail is a better word. And basically we want to show you something simple that you can make at home. We're going to start off with a tiki cocktail. And I find that tiki cocktails can sometimes be a little intimidating because some of them have about 20 ingredients. They have really complicated garnishes. Sometimes we think of them as being overly sweet as well. But in general, they're actually quite simple, some of them. And the Jungle Bird in particular, the one I'm showing you today, has not too many ingredients. So the first thing you're going to want to do is find a dark rum. I'm using Hamilton rum, and that's aged for 5 years. It's a Demerara rum, so it's not quite as dark as something like maybe the Kraken that you'll see, which is more of a black spice rum. This is just going to have that beautiful golden caramely color to it. And it's going to add a really lovely base note to the cocktail. So again, you're not going to want to use a white rum like a Bacardi, although that's fantastic in a mojito, and other cocktails are going to want to go for a dark rum. The other spirit I'm featuring in the Jungle Bird is Campari. So Campari you're probably more familiar with in something like a Negroni if you're a Negroni drinker. Also it appears in a Boulevardier, which is a Negroni with bourbon. For those who haven't heard that before, that's a fun one to try. So Campari is made in Italy. It's a bitter. So that adds a pretty unique spin to a tiki cocktail. You don't see that in too many tiki drinks, actually. The other thing we're going to need is pineapple juice. If you have a juicer and you want to be really ambitious and make fresh pineapple juice, great.
You can.
You totally can. Otherwise, very realistic that store-bought would be just fine and delicious in this. You're also going to want some fresh lime juice. We're going to use that in both the cocktail and the zero-proof cocktail. So if you have one of those little lime citrus presses, that's a great way to make fresh juice. You can store it in the fridge. You'll use it for all sorts of things. And then you're also going to need a plain simple syrup. Rich, can you give a little lesson on simple syrup?
Yeah. Simple syrup is exactly that, a simple syrup. Combination sugar, water in equal parts. We usually find that about a cup of water to a cup of sugar makes enough cocktail or enough syrup to make at least 8 cocktails. When you think about, you're only going to use about an ounce or so of sugar syrup in a particular cocktail. And if you have 8 people, you've got 8 cocktails. But if you don't, it'll last you all week. Depending on how you want that drink to be, if you want a little more viscosity, you can use a little bit more sugar than water, and that'll give you a thicker or richer syrup. You can also use things like raw cane sugar. It'll give you a darker color, but it'll also add complexity the same way that this rum does. But it's a really great ingredient to have around, not only for your cocktails or mocktails, but for anything that you want to sweeten, it's really great to pour over cakes and other things. So it's a very useful ingredient to have.
And also later, Rich will be featuring a basil simple syrup. So you want to talk about infusing herbs
Absolutely.
as well?
So here I'm going to be using this basil simple syrup. It's exactly the same process. The only thing that you do is once your syrup comes to a boil, add a handful, good handful of whatever herb you choose. It can be something growing in your backyard. It can be something store-bought like mint, which goes a long way. And throw that into your pot and let it cool down with that mixture. Strain it out and you have an incredibly infused spirit. And you can use anything that you want. You don't have to use herbs. You can use spices, anything that you have in your pantry that you think would be delicious. Use it, try it. If it doesn't work, make another batch. That's the great thing about simple syrup. It's cheap to make and super easy.
Yeah, and those are ingredients that most people have them on hand in their pantry, sugar and tap water. So again, really, really easy, low stakes, nothing too crazy that we're getting into here. And then I also want to have some fresh mint. You could do a very complicated garnish for a jungle bird. I know we see, like I said, we see tiki cocktails that have like a cherry and an orange and a flower and an umbrella. I'm not doing that today. I want to keep it really simple for you at home. So just the fresh mint. So getting into the proportions right away for this, I'm going to do 1.5 ounces of my rum. And I'm using a metal shaker. Anytime you're shaking a cocktail, it's usually because it has citrus juice in it. We shake things that have citrus so they get well incorporated. We stir things that are all spirit, like a Manhattan or a Negroni. So I have 1.5 ounces of the rum. And then I have pre-measured out into these little jars just to make my life a little easier, 1.5 ounces of pineapple juice. We're doing 3/4 ounce of Campari. So my jigger is 1 ounce on one side, 1/2 ounce on the other. So I'll want to kind of measure that accordingly. Your jigger at home, if you have one, might be 2 ounces on one side, 1 ounce on the other. That's kind of a standard as well. And then I'm doing 1/2 ounce of lime juice and 1/2 ounce of simple syrup. All of that goes into my shaker. I'm going to go ahead and add ice. Get my top on there, and I'm going to just shake this very vigorously. Don't just do that for drama. I know it looks dramatic sometimes when you're at a bar and we're shaking for a long time, but we're really trying to get it super cold, really well incorporated, very well mixed. My shaker has a strainer built right in. If yours doesn't, you'll use a Hawthorne strainer, which is that handy tool right there. I'm using a footed tumbler glass. I like a clear glass so I can see the color of this drink. And I'm going to strain right into it. I'm going to use some ice to top it off. Perfect. Thank you, Rich. So again, my ice goes in last because I don't want the drink to dilute too much. While we want a little dilution, we want a drink that comes out watery. So that's always something we're being aware of. And I'm going to take my mint sprigs, tuck them right into the side there, and voila, you have a jungle bird. So that is a classic drink invented in Kuala Lumpur at the Hyatt in the 1970s. That's the history behind it. And I hope you'll give it a try. Perfect for like an afternoon barbecue or in the evening. It actually makes a great after dinner drink too with the Campari bitter aspect in there.
Great in place of coffee.
So perfect. So I'm going to pass it over to Rich, who's going to do our zero proof cocktail.
Yes. I love making the zero proof cocktails when we're asked to make them. I think that there's a lot to be said for combining ingredients without alcohol to make something really, really delicious, because there's a lot of things out there. What we're using now are very summery ingredients, things that you can find almost year round, but we think of them particularly in the summer. Lime, pomegranate, making things fun at barbecues. But please feel free, use what's seasonal to you. If you can dream it, you can probably make it and make it taste good. So I encourage you to play around. So what I'm doing here is a mocktail or zero proof cocktail that we've named Manhattan Henge, named after that beautiful effect that happens, and it's happening this weekend.
This weekend.
Where the sun aligns itself perfectly in the middle of all of the streets that run west to east as the sun sets, and it creates this beautiful shadow effect on the buildings. So we're playing off of that shadow effect, shadow and light, in this play on a New York sour, which is a classic cocktail that would incorporate usually some kind of whiskey, sour mix, which is lemon, lime juice, and sugar. And then there would be, instead of an egg white to give it that beautiful frothy top, you're using red wine to create this beautiful color separation. I'm not doing that. I'm going to use lime juice, that basil simple syrup, a little bit of jalapeno and then pomegranate juice to top it off to give it that color separation. But do you want to talk a little bit about the jalapeno aspect?
Yeah, absolutely. So we did something fun for this cocktail, and when Rich first suggested it, I thought, interesting. I don't know how I'm going to feel about it, but I actually really love it. So we made pickled jalapenos for the weekend. We were having fish tacos.
For 4th of July.
And that's always a great thing to add to tacos or burgers, pickled jalapenos. Some of you may have made that at home before. If you haven't, you're gonna do a cup of white vinegar and half a cup of sugar. You bring that to a boil, and then you add rounds of jalapeno. You wanna slice them on the thinner side. 2 jalapenos is probably a good amount for that proportion of vinegar and sugar. So once the vinegar and sugar has boiled, in go the jalapenos. You let the whole thing cool, transfer it to a mason jar, and store it in the fridge. Now what we're doing in the cocktail, which is something pretty different, we're actually using a little bit of the jalapeno brine.
Yes, so that's what I have here, is that jalapeno brine, as we would call it. We don't have any salt in this particular brine, but you can add salt to it if you want, about a teaspoon or so, just to give it a little bit more of that saline quality. And it works beautifully in cocktails to give it like seasoning. You want things balanced, and salt is one of those things that your tongue craves. So throw it in there, by all means. And here, you're gonna get a little bit of spice from that. We left the membranes of the jalapenos in. You can cut them out and take the spice away, but leave the jalapeno flavor. Feel free to do what you wanna do. So I'm gonna build this cocktail out. I've measured things out here. So 1 ounce of lime juice. This is 3/4 an ounce of Basil simple syrup. And then 1/4 ounce of that jalapeno brine right into my shaker here with ice. And the reason I love this, it's kind of like a shrub in that way. A shrub is a traditional cocktail that uses vinegar and sugar to make it. But it adds that complexity, like as if alcohol were there. There's a fermentation that happens with vinegar, so it's already in place, but it's not alcoholic. Excuse me. Almost lost her there.
That's all right. So
now what we're gonna do,
yeah, we're using large ice cubes for this.
Yes, so what I'm gonna do is just grab one of those with my tongs here, as soon as they decide they wanna stop swimming around on me. Pop that in, and then we'll strain that over our ice cube. This is a large ice cube. They make silicone molds for these kinds of ice cubes, so you can do them at home. You don't have to buy them from a crazy ice maker. And then I'm going to pour my ounce of pomegranate juice into this little 2 ounce measuring cup because it has a spout on it. And I want to be able to control my stream when I pour this over the top so that we get maximum separation here. And you can see it start its little work there, keeping that separation. Beautiful.
And we'll hold that up to the camera so you can really see the color separation here. So essentially what we're playing with, and Rich will explain, is viscosity.
Yes, so you have liquids of different densities coming together, so one will float on top of the other. You have the simple syrup on the bottom, keeping it separate, but you don't want to move it too much before you serve the cocktail because it can start to blend, which it's already starting to do. And then to garnish, I have these beautiful tops of Thai basil that are growing outside here. The purple flower is on top, but then you have the beautiful green leaves. So there's that beautiful energy from green and then that purple to match the pomegranate. And then we put that right on the corner of our ice cube, and we have a beautiful little summer zero-proof cocktail.
Really pretty, and I think if you were to serve that to a friend who, for whatever reason, lifestyle choice, health reasons, doesn't imbibe alcohol, it's such a fun mocktail, such a fun zero-proof cocktail, and it really feels very festive and special.
And it's one of those things that because of the size of that ice cube, it dilutes slower, so it'll change over time the way that some of those really complex cocktails do in these beautiful cocktail bars we have around the country now. And it's lots of fun to drink.
So much fun. So it's been such a pleasure being here with all of you. Again, I'm Natasha Soto-Alborz.
And I'm Rich Dreyer.
And we're Violet and Vine of NY. We're on Instagram as @Violet and Vine of NY. If you want to reach out to us with cocktail questions, we're always happy to hear from people. You can snap a picture of your home bar and ask us for some advice on what you might make with what you have on hand. So again, thank you so much. We hope you have a wonderful afternoon.
Yeah, cheers.
Cheers.
Thank you, guys.
Thank you, Natasha and Rich, and thank you all for joining us today. Hope you have a great rest of your day.